My name is Maya Goldenberg, and I'm Associate Professor of Philosophy at the University of Guelph in Toronto. I'm also author of the forthcoming book, Vaccine Hesitancy, Public Trust, Expertise, and the War on Science. I first became involved with the center when I came to give a research talk. This was in 2016. I presented some of the early research that resulted in the book that I just mentioned. Now, today we're talking about COVID-19. And a good question to think about is, what does humanities and ethics have to offer in this current context of pandemic? Since the start of the pandemic, there's been this elevation of scientific and medical experts. In some countries, epidemiologists and public health researchers have become household names. There's also been more attention to the social sciences, especially economics, psychology, and demography. Now, less visible, but not invisible, is the role of humanities expertise for figuring out this pandemic and what to do about it. The pandemic makes clear that medical science alone can't solve COVID-19. Research into treatment and vaccines are certainly surging ahead at breakneck speed, but at the same time, there's also surging concerns about the licensing, distribution, and access to these treatments and vaccines. The ethical issues need to be addressed before these medical technologies make it to market. Now is the time to rethink what we aspire for in many systems of governance, not just healthcare. Ethics needs to be at the forefront of pandemic response. Public health needs to be similarly broad in its consideration of values. Some public health measures for responding to the virus are very well established, things like social distancing, masking, and test, trace, isolate. But each political decision to enact these measures, even well-established measures, are shrouded by uncertainty about unexpected consequences. Things like, how will the public react to the new mandate? And how will public health agencies be able to enforce those mandates equitably and effectively? Here, humanities offers rhetorical, historical, and ethical tools to look at the policy from multiple angles. This proves useful because some decisions cannot be reversed once unexpected harms emerge. To illustrate, the WHO did not prioritize palliative care and end-of-life protocols for dying patients during COVID. As a result, many people have died alone, and their families could not grieve or enact important death rituals like funerals. A historical look at past pandemics and epidemics would have highlighted the issue of death rituals in contexts like this one, by which I mean contexts where a high number of deaths were anticipated. Rhetorical analysis of the scientific and technical decisions being made today, values-based thinking of not just what we can expect, but what we aspire for during and after the crisis is exactly what humanities can offer during COVID-19. I'm pleased to be connected with places like the Center for Values in Medicine, Science, and Technology, where this kind of important work is being done. Thank you.